Hi friends, once again welcome back to my channel Mookambika Nursing. Friends, here we are discussing questions for nursing officer exam. We are discussing important and previous year questions. Already we completed 12 part. If you are watching first time, kindly go through my previous videos. The questions will helpful for your exam preparation, also boost your knowledge. Let's start today's question. Our first question, the type of placenta previa which is known as dangerous placenta previa is options. Option A, central placenta previa. Option B, type 2 posterior placenta previa. Option C, marginal placenta previa. Option D, type 2 anterior placenta previa. Here the question is, which type of placenta previa is known as dangerous placenta previa? Here we can see what is placenta previa means. When the placenta is implanted partially or completely over the lower uterine segment is called placenta previa. In placenta previa, the placenta is implanted in lower uterine segment. Okay, here the question is, which placenta previa is known as dangerous placenta previa? It is type 2 posterior placenta previa. Option B is the correct answer. Move on to the next question. The second question, the type of joint found between the skull bone is options. Option A, cartilaginous joint. Option B, synovial joint. Option C, fibrous joint. Option D, hinge joint. And the correct answer is, it is fibrous joint. Option C is the correct answer. Fibrous joints are mainly made up of dense connective tissue and they are immovable joints. Okay, they are mainly found between the skull bone. Move on to the next question. Typhoid oral vaccine is given at an interval of options. Option A, 1, 3, 5 days. Option B, 1, 2, 3 days. Option C, 1, 2, 4 days. Option D, 1, 7, 14 days. Here we can see typhoid vaccines are live vaccines and killed vaccines. Okay, live vaccines are oral and killed vaccines are injectable. Oral vaccines are given in an order of 1, 3 and 5 days. That is first day first dose, then third day, then fifth day. That is our question. Okay, typhoid oral vaccines are given at an interval of 1, 3 and 5 days. And injectable vaccines or killed vaccines are given IM route, intramuscularly. Injectable vaccines are effective as 70%. Okay, here our correct answer is option A. Oral vaccines are given at an interval of 1, 3 and 5 days. And these oral vaccines are effective like 62%. And the next question is, all are water washed diseases except options. Option A, scabies. Option B, trachoma. Option C, typhoid. Option D, conjunctivitis. Water washed diseases are mainly occurs due to lack of personal hygiene or inadequate water supply to a particular area. There we can see this water washed diseases. Some examples include Shigella, scabies, trachoma, conjunctivitis or water washed diseases. But typhoid is not a water washed disease. Option C is the correct answer. Move on to the next question. Polio virus shed maximum in stool up to options. Option A, 6 weeks. Option B, 8 weeks. Option C, 10 weeks. Option D, 12th week. Here the question is, after infection of polio virus, the maximum shedding of this virus through stool occurs at which week? Okay. Polio is mainly spread through fecal-oral route. Okay. Here the maximum shedding of virus occurs at 8th week. Option B is the correct answer. The virus is highly concentrated in stool in 2nd week. Okay. And it is maximum shedding occurs at 8th week. This is an important question. So here the correct answer is option B. And the next question is, bagasosis can be prevented by spraying. Options. Option A, 10% acetic acid. Option B, 5% acetic acid. Option C, 1% propionic acid. Option D, 2% propionic acid. Bagasosis occurs due to inhalation of sugarcane dust and this can be prevented by spraying 2% propionic acid. Option D is the correct answer. And the next question is, the most common type of dementia is options. Option A, Pick's disease. Option B, Parkinson's disease. Option C, Alzheimer's disease. Option D, Tick's disease. Question is, the most common type of dementia. Dementia is a type of short-term memory loss, and the most common type of dementia is Alzheimer's dementia or Alzheimer's disease. Option C is the correct answer. And the next question is, the drug which is used for managing withdrawal symptoms of opioid is options. Option A, clonidine. Option B, naltrexone. Option C, methadone. Option D, all of the above. Our question is, the drug which is used for controlling or managing the withdrawal symptoms of opioid is all these we can use. Okay, clonidine, naltrexone, methadone, all we can use to manage withdrawal symptoms of opioid. Option D is the correct answer. And the next question is, dysphomania is related to options. Option A, compulsion to drink alcohol. Option B, impulsive stealing. Option C, compulsion to drink water. Option D, compulsive smoking. The term dysphomania means it's compulsive drinking or compulsion to drink alcohol. Option A is the correct answer. And the next question is, a patient is suffering from whooping cough. Which one of the following complications occur for the patient? Options. Option A, brachial neuritis. Option B, bronchopneumonia. Option C, permanent tuberculosis. Option D, arthritis. Our question is, among this option, which complication can occur for an whooping cough patient? This whooping cough is also known as pertussis or 100-day cough. The complication, one of the complication can occur for this patient is bronchopneumonia. Option B is the correct answer. First, brachial neuritis is mainly occurs due to the effect of tetanus. Okay, so the complication can occur due to the pertussis or whooping cough is bronchopneumonia. Pulmonary tuberculosis occurs due to the infection with TB. Okay, correct answer is option B. Move on to the next question. What is the expected complication of chorionic villus biopsy? Options. Option A, limb abnormalities. Option B, Down syndrome. Option C, abortion. Option D, spina bifida. Our question is, one of the complication of chorionic villus biopsy is, chorionic villus means it's a finger-like projection which is present in the placenta. So the sampling is usually taken from the placenta. So one of the complication can occur due to this biopsy is abortion. Option C is the correct answer. And the next question is, who demonstrated transmission of malarial parasite by the bite of Anopheles mosquito? Options. Option A, Yvonne Behring. Option B, Shell Nelson. Option C, Sir Ronald Rose. Option D, Elberth. And the correct answer is, it is by Sir Ronald Rose. Option C is the correct answer. On to the next question. Diagnostic test used for scarlet fever is options. Option A, Mondos test. Option B, Dick test. Option C, Schick test. Option D, Wardell test. The test which is used for scarlet fever is Dick test. Option B is the correct answer. Mondos test for tuberculosis. Schick test is for diphtheria. Wardell test is for typhoid. Move on to the next question. Risk for the damage of fetus by maternal rubella is maximum if the infection occurs to the mother between options. Option A, 6 to 12 weeks of pregnancy. Option B, 16 to 20 weeks of pregnancy. Option C, 24 to 28th week of pregnancy. Option D, 30 to 34 weeks of pregnancy. The risk for damage of fetus by maternal rubella is maximum during the first trimester of pregnancy. Okay, first trimester is up to 12 week. Here the correct answer is 6 to 12 week. Option A is the correct answer. And the next question is, what is the other name of bad birth? Options. Option A, glossitis. Option B, halitosis. Option C, gingivitis. Option D, none of this. Bad birth means halitosis. Option B is the correct answer. Glossitis means inflammation of the tongue. First option. Option C, gingivitis means inflammation of the gums. Bad birth means halitosis. And the next question is, which of the following stain is used to detect Mycobacterium species? Options. Option A, gram stain. Option B, capsule stain. Option C, acid fast stain. Option D, endospore stain. The stain which is used to detect mycobacterium is acid-fast staining. Mycobacterium species include Mycobacterium tuberculosis, Mycobacterium leprae. All are staining by using acid-fast stain. Option C is the correct answer. Move on to the next question. Which condition is identified by Shield-Nelson technique? Options. Option A, typhoid. Option B, syphilis. Option C, tuberculosis. Option D, malaria. Shield-Nelson technique or Shield-Nelson staining is used for tuberculosis. Option C is the correct answer. Shield-Nelson technique or Shield-Nelson staining or acid-fast staining all are same. They are used to identify tuberculosis. Okay. And the next question is, cyst birth is given for which of the following condition? Options. Option A, appendectomy. Option B, hemorrhoidectomy. Option C, cholecystectomy. Option D, mastectomy. Cyst birth is given for hemorrhoidectomy. Okay, option B is the correct answer. The temperature for cyst birth is 105 to 110 degree Fahrenheit. Celsius means 40 to 43 degrees Celsius. Okay, here the correct answer is option B. And the next question is question from body mechanism. When lifting a patient onto a stretcher, the nurse should bend from the options. Option A, shoulder. Option B, back. Option C, waist. Option D, knee. While lifting the patient onto a stretcher, the nurse should bend from knees. Option D is the correct answer. And the next question is, the SA node is situated in options. Option A, right atrium. Option B, left atrium. Option C, right ventricle. Option D, left ventricle. SA node is also known as pacemaker of the heart. It is situated in the right atrium. Option A is the correct answer. And the next question is, the primary visual area is situated in the options. Option A, frontal lobe. Option B, parietal lobe. Option C, temporal lobe. Option D, occipital lobe. The visual area is located in occipital lobe. Option D is the correct answer. The primary motor area is located in the frontal lobe and location of auditory area is in the temporal lobe. Visual area is in occipital lobe. Move on to the next question. The taste sensation from posterior 1/3 of the tongue is conveyed by options. Option A, facial nerve. Option B, glossopharyngeal nerve. Option C, vagus nerve. Option D, hypoglossal nerve. And the correct answer is by glossopharyngeal nerve. Option B is the correct answer. Move on to the next question. Islets of Langerhans are present in options. Option A, pancreas. Option B, spleen. Option C, liver. Option D, stomach. Islets of Langerhans are present in the pancreas. Option A is the correct answer. And the next question is, hydramnios is a condition where there is excess volume of options. Option A, amniotic fluid. Option B, peritoneal fluid. Option C, pleural fluid. Option D, pericardial fluid. Hydramnios is related to amniotic fluid, that is polyhydramnios or oligohydramnios, all related to amniotic fluid. Hydramnios is a condition where there is excess volume of amniotic fluid. Excess volume means polyhydramnios. Okay, so here the correct answer is option A. We are discussing important and previous year questions. If it is useful for your studies, please share my videos to your friend circle.